to say thanks to Rick for joining us today with today's presentation. I want to welcome everyone to Rick's presentation. Looks like Rick's going to start by himself here. So if you join him, joining this virtually or online, we really appreciate you participating in our program. But Rick's going to visit with us a little bit about some of those ACEs that we like to call them so much, and how what's going on with kids and how we can help support them as we transition from some very, very unique times here in Kansas. So Rick joins us from Hutchinson today. He's a SaltHawk and USD 308. So we appreciate Rick being with us. Rick, thank you so much.
All right. Hey, thanks, Jay. That's the best introduction I've had all day long. So I appreciate that. So just a little bit about me. This is my 31st year in public education. I spent 5 years in Emporia to kick off my career a long time ago, and the last 26 have been here in Hutch. This is my 16th year in HR and carrying the title of assistant superintendent, and kind of explain some of the gray hairs you may see right now, so I give you some perspective there. Hutch's journey in the area of childhood trauma is probably in year 4. A little bit about our community. If you weren't aware, Hutchinson is home to 4 different levels of prison systems. If you watch the news, we've got a rampant drug trade that everybody talks about, and find very difficult ways of trying to make a positive impact on that. And our kids, as a result, come to school with baggage. They come from poverty. 70% of our kids come from poverty. And so it's been really key for us to try to hone in on some of the behaviors that our kids and our staff have exhibited over time, which can be tied back to perhaps some experiences from their youth. I need to share my screen so you can watch my PowerPoint as we go along. All right, not in the right spot. So there's my contact information. You can come back to the PowerPoint or find it on the USA website at some point in time down the road if you'd like to reflect or follow up or ask any questions. I do want to tell people on the front side that I've done this type of presentation probably for 3 years, maybe a dozen or so times over that span. It's going to be triggering for some people. I most recently did this for some local HR directors, and I had someone I'd known for 10 years reach out to me and share that she had not yet connected in her life some things that she deals with now back to what happened to her as a child. And she admitted by email that she had ACEs, and that perhaps this was a step for her on her healing journey. So just keep in mind that you need to take care of you. And I apologize in advance if I say something here or brings up a past memory, but this is something we have to have on the table. Something else I might mention too is, like with poverty, we can judge somebody maybe how they're dressed or the kind of car they drive, or maybe if we know where they live, but they know money is not something that is very readily available to them. Poverty knows no financial boundaries. I'm sorry. ACEs know financial boundaries. Adverse child experiences can and have occurred to people of all socioeconomic statuses, and I have some data down the road that will speak to that. A quick look at an agenda for today. We'll first lay some foundation with the original ACE study that occurred in the 90s. We'll talk a little about some workforce data that is reflective of the state of Kansas. Because of the pandemic, I threw in a piece on secondary trauma. Our kids and our adults are coming back to work with some challenges based upon the last 5 months. That is a very real part of what we do and what we have to deal with as leaders. And then we'll wrap up with some self-care strategies. What do you do now that you know that maybe there's some challenges that need to be addressed? I first want to start with a fairly commonly used quote from Rice and Groves, and you can reflect on that for 1 second. I do want to bring up a little bit of emphasis on some of the wording they chose. Number one, it's not just experience, it's an exceptional experience. And it's not just an event, it's a powerful and a dangerous event that causes our ability to cope, creates great challenges for us. It's overwhelming. And so as we talk about what is trauma, we need to frame in our mind the kind of events that our kids and adults have experienced that have carried forward with them to present day. So back to the study. 1995, Vince Felitti had a weight loss clinic in the Kaiser Permanente Hospital in San Diego, was visiting with one of his patients. who was having a very difficult time of maintaining weight. And in the course of questioning, she revealed that she had been sexually abused as a child, which for him was an aha moment. He partnered with Dr. Robert Anda with the Centers for Disease Control, and together they launched this study, over 17,000 participants. The key thing about the study is the demographic. 75% white, mostly over the age of 40. Most had some college, all had good jobs, or they wouldn't have been able to participate in a study like this. Certainly insurance was a big part of that. So we're not talking about inner city Chicago or East St. Louis or the projects in Washington, D.C. We're talking about a group of people that we might believe we're doing just fine. And the reality is there were some challenges there that needed to be addressed. As they looked at the ACE study, they identified 10 areas to focus on. 5 per person, which is the physical, emotional, sexual abuse, physical, emotional neglect, and then 5 household functions: mental illness, domestic violence, divorce, incarceration, on some level of substance abuse. There are those right now in our society who believe there are other ACEs, and certainly prior to the study, they had others on the board. They just identified those 10 as part of the study. But certainly racism, ongoing bullying are 2 that you commonly see other people referring to now as ACEs. Certainly extreme poverty can also have an impact at the same time. As we think about the study, go back to those 17,000 participants, 64% of that group had at least one ACE. And that, you know, if you think about a group of 20 people, that's roughly 13 of 20 that have one of those 10 factors. The study went on to talk about, of the 64% who have at least one ACE that you see on your screen, 87% of that group had 2 or more. So if you go back to that 13 of the 20 have 1, 11 of that group had 2 or more. So if you have one ACE, there is a high probability there are 2 or more somewhere in your past or something that you dealt with as a child. So here are some data that talks about the impacts of ACEs when you compare people with ACEs to people with none. And I pulled this data off a couple of articles on Psychology Today. I picked the 4 because there is a lot of more common behaviors that you see in people. Certainly smoking is one. Anxiety, we have a lot of anxiety going on right now, but you're more prevalent to have anxiety if you have a past history of ACEs with no real treatment, especially compared to people who have none. You're 7 times more likely to become an alcoholic. And alcohol is a big part of our society and the challenges, especially, again, we refer to the pandemic where there's been a lot of stress. You know, ironically, you know, liquor stores were considered an essential group of employees that were allowed to stay open because having people deal with not having alcohol was far worse than allowing them to keep purchasing alcohol. But that last section there at the bottom, to me, is the eye opener. You know, when you compare an individual with 6 ACEs to those with 0, there's a 20-year lower life expectancy. And in Hutchinson, we have data from the last census that was released a year and a half ago that in the northwest part of Hutch, the life expectancy was in the mid-80s. And in the south part of Hutch, it was in the low to mid 60s. So, you know, doesn't mean everybody in the south part of Hutch has 6 ACEs, but it's an interesting overlay when you look at the data that in Hutchinson itself, there is a 20-year difference in life expectancy between the northwest part and the south part of Hutchinson. And I want to make sure you understand, if you've read that last sentence, that's not a typo. People who have a score of 7 or more are more likely by 31,000% to have attempted suicide. And I almost put in a parenthesis that says, yes, 31,000%. That's a startling number. And that's just why we have to be so vigilant in taking care of our staff and our students, because our staff they need healing. Our kids need protection. And this is what can happen if we aren't able to appropriately identify and provide support to those 2 groups of people. So here's some Kansas data. This data is getting a little long in the tooth. It's from 2015. I have a slide that documents that here in a bit. You know, 1 of every 2 Kansas have experienced at least 1 ACE. 1 in 3 have 2 or more. And 1 in 5 Kansas have experienced at least 3 ACEs. more data. Women are a little bit more prevalent with ACEs than what men are. 1 in 4 between ages of 18 to 64 have at least 3. The stat at the bottom, I'm a big fan of that because if you take a look at the idea that the lower life expectancy by 20 years, that's going to be a smaller number probably than what it could really be, because unfortunately we lose people with high ACEs sooner. And the last statistic, again, we go back to the idea earlier about poverty. You know, as you might expect, 1 in 3 adults with low income have high ACE scores, okay? But right below that, income of people with more that make more than 50,000 is still 16%. I mean, that's a huge thing when you think about educators and people in leadership positions. You know, that 50,000 is a fairly easy threshold when you look at principals and directors and teachers who have master's degrees, people who we believe have really have again put things together. They have a 16% likelihood of they have some trauma in their past. Here's some Reno County data, and not just Reno County data, statewide data. The areas in white, I want to make sure that you understand that they are white because there was an insufficient sample in 2015 when that data was released. So if you look at the metro area around Wichita, where you see Reno, McPherson, Harvey, Butler, you know, the counties surrounding that region are all in white. You know, logic would tell you most likely there are a high prevalence of ACEs in those counties as well, but just because of sample size in 2015, there wasn't the data to establish those. But in talking to some colleagues in Rice County, I know they're dealing with some of the same challenges we have in Hutchinson right now. Again, if you look at the blue section, again, more than 21% of the population have at least 3 ACEs. And if you count the blue squares, that's about 16% of our county, of the counties in Kansas, have a population where 1 in 5, again, have at least 3 ACEs. It's a big number. Here's some work data that will give you a better idea of exactly how this is impacting the employees that come to school every day. And as you might expect, the more ACEs somebody has, the greater the problem. Certainly job problems, and there's real no definition that came with that. You can think of a variety of things in terms of employee relations and getting to work on time. You know, absenteeism is listed, and obviously the more ACEs, the more absences, but it doesn't talk about presenteeism. And that's the people who come to work every day, even though they're really not very effective, but they keep coming because they want to keep the job. So I think that would be another area I think would be really interesting if it was ever studied to find out how that impacts people with ACEs. And as we know, there's been tons of studies that talk about finance and the impact and the stress that finances have on us as individuals. I'll let you absorb this pyramid for a second, but the idea, generally speaking, is between conception and death. This is how, as we go over through time, how our bodies react to ACEs. Starting with conception, and you have experiences as a child which disrupts the brain and how it develops, and which can lead then to social-emotional cognitive impairment, which probably is all happening during maybe elementary, middle school, into high school. Then you hit the blue section, the adoption of health risk behaviors, whether it's smoking or alcohol or a number of other things that are negative in general, which is just, it becomes a coping strategy or a way to escape perhaps what they deal with. That can be perhaps teenager into adulthood. And then, as we talked before, the challenges with early death there at the top of the pyramid. The one thing about this particular graphic that I want to add, just an idea, there was a study done several years ago. It's called the Cherry Blossom Study. You can find it on YouTube if you just do a quick search for that. And the Cherry Blossom Study introduced the idea of epigenetics. And that's the philosophy that we as adults can pass through our DNA code experiences on to another generation. And what this study focused on was lab rats. And the lab rats were a set of males who were in a metal cage. The researchers would introduce a cherry blossom set into the cage, at the same time electrify it. So every time lab rats smelled cherry blossoms, they received an electric shock. And over the course of time, just like Pavlov's dog, they were conditioned to expect that when they smelled cherry blossom, they would receive an electric shock. Phase 2 of that study, they introduced male rats into female rats. And then once the female rats were impregnated, the male rats were removed and sent to wherever you send male rats when you don't need them anymore. The females gave birth to their young offspring. And as these young rats matured, the researchers then came back and they put them in a cage and introduced a cherry blossom scent. And those young rats reacted in the exact same manner as their fathers did when the scent was originally introduced a generation ago. Again, those young offspring had no connection whatsoever to the fathers. They never saw them, no interaction, but yet the memory of that was passed down through the wiring, the DNA code into the offspring. So that leads us to this next slide. And all I know about the Sidran Institute is on this slide, but it's really some really good information. The limbic system, and as I talk to staff about childhood experiences, I refer to the limbic system as the part of the brain where we decide, are we okay? That's right before we go into fight, flight, or freeze, where the kids are assessing, am I okay here or am I not okay here? But what this is suggesting is that emotions, not necessarily the memory, but the memory of emotions is stored here as well. So as a child, you may have a hugely traumatic event, and the imprint of the emotion of that is stored in the limbic system. So through your life, you may have issues where anger or terror or whatever it might be are a part of who you are, because that's stored in the limbic system, but you have no actual memory, or your body, your brain has protected you by suppressing that memory. So you have no idea why you're angry all the time, because the limbic system is saying, hey, this is part of who you are, but your brain is saying, I have no recollection of why this is in place. And this is really a hard thing for educators when you have kids who have these feelings that are stored in the limbic system, but at the same time, kids can't say why. And so helping them unlock that is a challenge that none of us as educators are ever prepared to do. That is social workers and therapists and people who we have to rely on in order to help us help kids achieve at a much higher level, because a kid who's not regulated is not going to learn well. This next section on secondary trauma, I probably would not have introduced if it wasn't a pandemic. But since we're here in a pandemic, and knowing that our kids have been away from us for 5 months, and many of our adults have struggled with financial issues for that same amount of time, I think it's important to at least put the idea on the table that people are coming back stressed. We're all coming back stressed. And so understanding the source behind that stress, I think, is an important part of our conversation. And so you can see the other terms. Secondary trauma is also referred to as vicarious trauma, burnout. Compassion fatigue is one that's most frequently used when we talk about teachers, because they give and they give and they give, and our kids are so needy that they just wear out. And it's been a wonderful blessing in USD 308 that we started school yesterday, and our teachers are back getting in their element. And a lot of that stress that they've been carrying was allowed to evaporate just because they were able to once again connect with students. And that's a huge part of who they are, and a huge part of their well-being is to work with their kids. Here's a short list, I guess, of some symptoms of secondary trauma. The intent of this is not for people to earn points by identifying the most symptoms, but if you have a pattern of symptoms that you can identify off this list, I guess the question to be asking yourself is, what should I be doing about that? Because it is a sign of more challenges ahead, that if you are not taking good care of yourself, then you're going to set yourself up for some failures somewhere down the road. You might ask your secretary or another adult in the building if this is ever you, because sooner or later we all reach this point and we don't always know it. The people around you, the people who know you best, or if loved ones, are the ones who can be able to tell you whether or not you're managing life very well right now. And I think it's important for you to understand that we don't always filter well. We think we're overcoming it and we think we're doing a great job, but the people who see us day in, day out are a much better barometer in terms of how we're handling the world as it stands. Just a little side note on stress. There are commonly identified 3 areas of stress. Number 1, positive stress. This is quote normal. The first day of school is a nice example of positive stress. It's something that we can handle as students. It prepares them for other types of stress later on, but they learn that I can overcome certain things. It's not lasting. It is something that ends up positive, but yet it creates that same kind of feeling that they get used to what that is, and so we can help them through that. Tolerable stress is more severe, but it's not long lasting. With a proper support, people can get through tolerable stress. If you're a young child, maybe the loss of your first pet, perhaps the death of a family member. And certainly right now, Hurricane Laura for people along the Gulf Coast is going to introduce a lot of tolerable stress. You have a home that's completely wiped out and you lose a lot of possessions. You can rebuild the home. Your family is still safe. You can put those pieces back together with support from other caring individuals. People can cope with this and they can put themselves back on a positive road once again. But the toxic stress is where we talk about childhood trauma. Prolonged exposure to toxic stress impacts the wiring of the brain. The stress hormones can do damage to the neurodevelopment of our brain as kids are in school. You go back to the quote from Rice and Groves, we talked about those exceptional experiences, dangerous events, and overwhelming our ability to cope. And that overlays really nicely with this slide on toxic stress. And this is the area where we're all in the danger zone. So what? So we know about stress now. We understand the study from Dr. Filiti and Dr. Anda. What do you do with that? Because it just admiring the problem doesn't make it go away. Well, let's talk about some of the good things. Number 1, resilience. And this is Pat Stanislavski from Partnering for Prevention. I really like this quote. And what it really speaks to is our ability to overcome adversities in life. And you can read that word for word, but the thing to remember is with an ace, it's always an ace. If someone has 4 aces right now, they'll always have 4 aces. We can't erase that. We can't make it 1. It can't get back to 0. But because of the plasticity of the brain, we can help people do some rewiring, which will allow them to have a high number of aces and yet be completely productive members of our society who are well adjusted and who are in control of what they're doing and perhaps even helping other people overcome that, because they've had the support and the care and the love that they need to put their brain back in a good place once again. It would be really hard to plug the Grand Canyon, but technically it could be done. And you could force the Colorado River down a different path if you really have the horsepower to make that happen. Same thing with our brains. Some of those challenges that kids have experienced are like the Grand Canyon running through there. It just knows one path, and it's a really deep path. With the right care, love, and support, we can help kids rewire that past experience. And staying with the Partnering for Prevention, once again, some protective factors. And I think this is written and intended for children. But if you think about the adults who work with you, for you, near you, whatever the case may be, they have the same needs. Caring relationships. Do you have employees who come to work who are completely isolated, who aren't connected? Whether it's their choice or not, something's not being done to build that sense of community for them. Are there expectations? Do we just know that this particular person just kind of goes through the day and that's just about the best they can do? Or has anybody actually helped them raise the bar? Does that person have belief in their self that they can do better? And if they don't have the horsepower themselves, we need to provide the opportunities for them to make that happen. So the ABCs of healthcare. Self-care, the very definition is taking action to preserve or improve one's own health. Taking care of you. If you can't read the graphic, the subtitle on that cartoon is the therapist is saying to Humpty Dumpty, eventually I'd like to see you pull yourself back together. Well, man, that sounds great, and it seems like, yeah, Humpty Dumpty should just fix those cracks and be done. But the reality is, making that happen, it's a nice goal, but there needs to be some work done to make that happen. Part of that work is regaining control. And on this slide, actually, there's two slides that have some areas that people can focus on. The important thing as you scan the list is that you're intentional. Pick one or two things and be purposeful about getting it done. It doesn't do you any good just to go for a walk once a week or whenever you feel like it. If walking is going to be part of you regaining control, you have to set up the goals. You know, how many steps a day, or I'm going for a walk as soon as I get home from work, or right after supper, or I'm going to hit the gym, or whatever it might be. You have to be intentional and purposeful about putting those pieces into place, or they're not going to be effective, and you're going to get discouraged. Again, if you can't read the quote on this particular cartoon, the secretary says, "That's my survival kit. It has a meditation tape, aspirin, and rose-colored glasses." So, you know, whatever your self-care kit is, figure that out. Keep it handy. You know, those are, again, obviously meant for effect. You know, rose-colored glasses, we'd all wish we had a set of those we could wear. But there are things we can all put together that helps us make better choices or puts us in a better spot, or maybe right after a really hard meeting, you need to take a self-care moment. You owe that to yourself. You need to make sure you pick things that are meaningful to you. Just don't say, "Oh, right, I need to listen to music." Well, you know, if you're not set up to listen to music, then doing it just to do it won't help you. You know, I don't have the best feet in the world. So for me, competitive dancing would not be a positive self-help strategy. So you need to pick something that you feel really good about. If you don't have a pet, but yet you have the capacity to own one, you know, pet owners are more healthy, according to research, than people who don't own them, because you spend your time caring for the pet, and you can snuggle and you can walk it, and it can be your kind of a friend when you need one. And so the important thing is figuring what are 2 or 3 things that you can do for you and being intentional about making that happen. So this is a self-care wheel, and I'm pretty sure it's gonna be hard for you to read these. You can find this you can just Google self-care wheel, and I think you'll find it. I'll just go through real quick and highlight a few of the areas for each particular section. In the physical area, you eat healthy. You know, it's really easy right now to run through McDonald's and pick up a couple of McDoubles or whatever it might be, but you need to be intentional about eating healthy. You need to exercise. Turn off your cell phone. What are things that physically you can do to help you be in a better spot? For the psychological category, self-reflection, journal. Do you like to write? If so, you know, do a diary. Capture some thoughts, get it out of your system. Drawing and painting, again, those kind of things that let your brain engage with your hand to help you process some challenges. From the emotional side, a variety of options. Number 1, find a hobby. Laugh. Treat yourself. What is it you do for you? Maybe you would like to treat yourself to getting your toenails done, or perhaps it's you know what, I'm going to go get some ice cream, or ask someone to go with you. You know, find a way to connect and do things on the emotional side for you. One word of caution, as you look at these, make sure they're appropriate. In this particular category, there is a section for flirt. I don't have time to do any kind of HR support on sensitivity training, but you make sure what you pick is appropriate, not just for you, but for somebody else if you happen to engage them at some level. From the spiritual side, perhaps self-explanatory, meditation, yoga, pray, and even in here, it's volunteering. You know, giving of yourself for others is a nice way for you, if you're wired that way, to provide yourself with some self-care. In the personal category, again, what can you do for you? Set goals. You know, where do you want to be a month now? If you're going to set walking as a form of exercise, how many steps do you want to start with? Where do you want to be in a month? Be social. Get around other people. Have that opportunity. It's not just about you. You need to make sure you're giving yourself an opportunity to visit, talk, interact with others other than you outside the work area. And again, something just for you. What is it? Treat yourself. And that is something you have to figure out for yourself. Finally, the professional category, eat lunch daily. Set aside a small amount of time and eat something healthy, but be intentional about that, because with our jobs as leaders, lunch is kind of a catch as catch can. And that's one of the worst things that you can do for you is not be unscheduled to refuel your body. Use a vacation day. My wife will tell you, for me, I'm always left. She said, how many are you going to leave on the table this year? Because we're a use it or lose it. I take vacation days away from myself almost every year. Not the most healthy thing for me. I should probably do a better job of scheduling a vacation day. Work will go on. It'll be fine until you come back. None of us are totally inexpendable. And again, I didn't hear professionally network. If you're a superintendent or like me, an HR director, we need to be connected to other people who do what we do. We won't have all the answers, but someone in the network will have an answer. Build a network that you can reach out to, connect with, to partner with you on your journey. So bottom line, like the graphic shows, you can't pour from an empty cup. All we do as leaders is give to other people. We are expected to be all things to all people all the time. If you're at the building level, it's your teachers and custodians and the paras who are continually coming to you, hey, I need this, and you just dig deep and you keep pouring and you keep pouring. If you're a central office person, it's the same thing, building principles, but with a whole lot more people and a different set of responsibilities. If you don't take care of yourself, your capacity to truly serve the people that you want to be successful is going to be limited. And again, you owe it to you to give everybody else the best you can. So on this slide, if you're not sure where to enter a particular path, here's just some things to think about. I'll just plug in the pictures here. If you look at this continuum, certainly you need a good night's rest, and you need to be drinking water, and you be taking care of you. If physiologically you're in a good place, then move up a level. So is it your safety? Do you feel good that your emotions are in check, that you work in an environment where you feel safe? Okay, move up. Belonging. Where are you with your peer relationships? Do you feel valued? So maybe that's the place where, I don't have a great deal of peer support. Well, so find a coworker or a colleague or a supervisor, somebody you can say, hey, I need to plug in. So enter here. Don't think that you have to start at the top one. Oh my goodness, I'm not problem solving at all. That's where I need to start, because that's not the place to find success. You need to go to the lowest level on the continuum, be intentional, put yourself there, and work your way up, because you're not going to be a great problem solver if you're not sleeping well. Those pieces won't work. You have to put all of that other factors into place to really be at the top, where you probably are the best employee you can possibly be. So this, as I wrap up here, last slide, just a couple of resources that I think would really help people on their journey. On YouTube, look for Removed. There's a Removed 1, Removed 2, and this is a story about Zoe. And in this story, Zoe comes from a very challenging home. And it's easy to focus on Zoe and what she experienced and how it impacted her at school, and she has a foster parent. But as an employer, as someone who works with other adults, think about the adults in this particular story. The parents at home when Zoe was not having success. What if they're your employees? The foster parent. What if that person's your employee and she's dealing with somebody who she's trying to give a second chance to? And after you watch number 1, Removed 1, about 12 minutes, pick up the other 22 minutes of Removed 2. That tells the rest of Zoe's story. And that really accentuates, if we can give kids a positive experience, wonderful things are going to happen. Just spoiler alert, keep a hanky close, or a box of Kleenex. Secondly, the best book I would have you read is Childhood Disrupted by Donna Jackson Nakazawa. This is just a great book written. She is a researcher, author, has a lot of her personal experiences, but she writes it at a level that we can all understand. Just telling, there's a lot of case histories of kids and what happened as a child and how it impacted them as adulthood, and what happened once they got the healing that they needed, how their life turned around. There's other great books out there like The Healing Well by Nadine Burke Harris. For me, that was a little bit too wordy. She's a doctor and very intelligent, obviously, and that was a little more difficult book for me to get into. Very popular book by the same token, but I would certainly recommend you start with Childhood Disrupted. And the last thing, as an employer, think about an employee assistance program. We're probably in year 5 with our EAP. It costs us, we have a staff of about 900, costs us about $20,000 a year. But right now, according to our data, 6% of our staff are making use of that. And according to what New Directions Behavioral Health, who is our sponsor, our plan owner, that's higher than average. So you know what, that for our 6%, that is a huge benefit for them to hopefully help them be a better employee when they are with us. With that, I'm going to close out my part. Again, if you have a copy of the slide deck, my contact information is on slide number 1. Shoot me an email, give me a call. Happy to connect or provide some sort of insight or support. But the bottom line is 2 things: take care of you, and then have a plan to take care of your employees, because everybody wins.
So Rick, how long have you been working with social emotional pieces?
It's been about 4 years. You're probably familiar with Randy Sprick's work,
Yes.
Safe and Civil Schools. Randy was in our district maybe 5 years ago to introduce that, and that structure really helped us with a lot of kids creating those boundaries. But we found that there was some kids that we still weren't reaching, and we stumbled across the ACEs science and connect with Jim Sporleader, and he's been in our district a couple of times, and in Hutchinson he's a great partner with ESDAC, and we heard a webinar that he gave, and that really what has launched our trauma-informed practice. And so some of our teachers have just done a wonderful job of creating the zones of regulation and other kind of learning opportunities for kids to help them, and just understanding the importance of knowing the triggers behind the behavior, because if all you do is deal with the behavior, you never really find the trigger.
Yeah.
And that's hard, and we have hard kids, and it's a thing but we can't let go of that. So it's a never-ending journey for us.
The piece that you mentioned, and I've seen this presentation, Marcia Weisman does some work for us here at USA. We've gone around a couple of times, and I've seen her presentations multiple times. But I'll tell you, the one piece that you mentioned today that maybe I don't know that I ever put the 2 together was that once a kid has particular ACE, that they always have that ACE.
Right.
They can overcome it, like
Right.
you said, but it's
You
always
can't erase
there.
it.
I never really put those pieces together until you said that.
Yeah. So it's important stuff, and it's a part of everybody, not just education. It's kind of amazing that we're now, more than 20 years past that groundbreaking study, and it still feels like we're in our infancy of really understanding how do we help our kids and adults.
Oh, I agree. And it's, the science is really pretty simple.
Yeah.
It's just a matter of paying attention to it.
Right. And it's been validated on numerous occasions. That initial study it's rock solid.
Yeah.
Yeah.
Yeah. Well, thanks again for putting
Sure.
this presentation together. We're going to, I think what we're going to do is once we get all our presentations together and put out there, what we're going to do over the next probably month or so is we'll probably highlight 2 or 3 presentations a week. And that way we can put those constant reminders in front of our folks that are in attendance.
Sure.
And then once we kind of do that, I'm not sure we're going to disband some of these videos, because I'm sitting here watching. Well, I listened to 1 or 2, but
Right.
I've got my screen rolling on 4 or 5, and I'm actually kind of excited to look at some of these. But
Yeah.
some of this is really good videos and good information that we may just put back in a library for people to grab the resources and and use down the road. I'm not going to do that till our participants have a chance to review it first. But
Yeah, sure.
yeah,
Understand.
this is another good piece that I think, just hearing you talk about this would be great if a principal had a young teacher coming in and just wanted to introduce them to it really quickly. You're not going to go deep into
Right.
into the explanations, but just an introductory piece of this is what an ACE is. This is where it's come about. Here's maybe 1 or 2 steps that you can put into place.
Yeah, well, I've had great success. I've worked with Wichita State and their student teachers. I've
Mhm.
got next Wednesday is one for the fall semester. This is probably going to be the 4th or 5th time. And we were in person, the instructor's Kathy Durano, and she has them right, but you'd be amazed probably wouldn't be amazed at the feedback. It's like, oh my goodness, I know a kid that this has to be this kid. And thank you for and I give them more practical strategies and things that they can do that,
Yeah.
This time, usually it's more towards the end of the semester, but here I get to kind of kick it off. And I show removed, and it's a tearjerker. It breaks your heart, but that's kids that we have across Kansas, and from that standpoint, I know those student teachers I feel like for them it's a potential for them to make a life changing perspective of what they can do for kids as a teacher. But there's a lot of old guard out there who still believe just get a bigger hammer. If you'll beat them into submission.
Toughen
and
up.
I tell our teachers, look, when I was 30 years ago, that's all we knew. We thought it was effective, and it wasn't, and it's not effective for anybody else. But we can't. It's hard to root that out of some people.
It is, and it's as simple as telling coaches sometimes that yelling doesn't work for every kid.
Right.
You can be a screamer and a yeller. That doesn't mean it's going to work.
Well, I tell our subs, I said, you need your own strategy to get attention of kids, because you can yell once, it'll work once, and then you've shot that bullet. So that's not going to be a long-term solution.
You bet. Well, Rick, thanks again for sharing, and we really appreciate it.
Hey, happy to help. Enjoy the rest of your day.
You too. Take care.
Bye
Bye-bye.
bye.